am Susan Carlson, former First Lady of Minnesota and retired juvenile court judicial officer. And through my experience in juvenile court, I became aware of this significant issue that was not being dealt with in the systems and in our society. And so I got involved with the issue of fetal alcohol and discovered that there was not a statewide organization that specifically dealt with the issue of fetal alcohol. After Arnie left office, I found the Minnesota Organization on Fetal Alcohol Syndrome because I wanted a statewide presence on the issue.
A connection with MOFAS, I was actually introduced to MOFAS through another organization, but once I read about MOFAS and learned more about what the organization stood for, it just was the right connection. For me, it was just definitely a right fit as far as the mission and vision. And just as I was introduced to the people at MOFAS at the office, I knew that is definitely the right place for me in connecting with the staff and the other volunteers as well. And that's how I originally became connected.
When our kids were diagnosed and I started to talk with other adoptive parents in a support group we were in for just adoption, I found out about MOFAS from another parent who had a child diagnosed, and soon went online to investigate it and get on their emails and newsletters, and that's when I found out about the Family Seminar Series, and I knew it was exactly what we needed at that time. So that's how we began.
Yep.
Every day of my life, I work with pregnant women who have had or do have substance abuse issues during pregnancy. And so I'm very passionate about educating them about a healthy lifestyle during pregnancy, talking about what our concerns are about alcohol and substance abuse during pregnancy. But MOFAS is important to me because the other thing that I'm really passionate about, besides doing direct service or working directly with patients, is education and getting that information out there so that others know from my experience, from what I've learned. And I think MOFAS does an excellent job of doing that, of getting that message out.
What we were hearing was happening is that there were women that were trying to quit, but they wouldn't go in for prenatal care until they thought they had quit long enough that it couldn't be detected by any test. And this isn't really a helpful way to go. We want them to build that trusted relationship early with their physician, and we want them to understand that if they are struggling with quitting because they have so much stress in their life and they don't have alternatives to smoking or drinking or other things, that there are people around that can help them find healthy ways to cope with stress so that they can stay free from alcohol and drugs.
There's a lot of educating left to do out there about fetal alcohol syndrome. I really believe that there's people in the workplace today that suffer from fetal alcohol syndrome that have no idea what it is. They don't know why they behave the way they do, and they don't even know they're victims of perhaps fetal alcohol syndrome. They've just struggled with things all their lives. And if we're ever going to get behavior patterns changed, we all need to, as companies, help educate the public on what this does and what a difference it can make if we can prevent even one life from having to go through this.
Well, I think MOFAS is doing a fabulous job. It seems to me that there are three things that MOFAS is doing, and one is education in terms of prevention. And that's the part that I know the most about. Certainly the diagnosis is extremely important, and then the support that MOFAS is giving to families who do have affected children. I think all three of these things are extremely important.
Well, the volunteer part is easy, and I think that the donor part just is not really, I honestly don't see myself necessarily as a donor, but I guess I am. To me that just goes in line with volunteering. Being a donor is very easy because to me it's what I value as being part of a really good, organization, and really putting my volunteer time and effort there too. It's very easy to be a volunteer for an organization where the other volunteers, the other staff, and the community is supportive of, and people get behind and they put their energy there.
The thing I'm most proud about MOFAS is what they've been able to do with partnerships in the state of Minnesota. They're just not out there doing this alone. They're forging partnerships throughout the state with PACER organization, with public health organizations, and I think the work that they do with families is what I feel is the heart of the organization. And you hear so many stories from parents and families about the work that MOFAS does.
First of all, we realized our listeners knew so little about it, and we knew so little about it. And then we were exposed to the MOFAS committee that was created, and some of those people in the committee actually were taking care of or had children that have fetal alcohol syndrome. And we actually saw what the disease does to some of these kids. And we wrapped our arms around this project because we don't want to see that happen anymore. And we really, really, really want to get our listeners engaged and supporting this project that is so very, very important for people to understand.
What MOFAS brings immediately is credibility. Credibility with the legislators that we needed to influence, but also with a much broader community. They're known for putting women and families first. So if they thought this would be a benefit to moms, that would be believable to a lot of people. In fact, when we talked to some legislators when a staff member from MOFAS wasn't around, that was a frequent question we got. Is MOFAS on board with this? What would they think? That's how well known they are, and I think that's how well trusted they are.
We ourselves experienced through retreats, through the family seminar series, from transition classes that we went to, that
With our teens.
that there was a great deal to be gained with the information that we were getting, but then there was this whole other level of the networking with other families that were going through many of the same things that we were. Some who had maybe done this, same thing we were trying to do 2 years earlier, and just found such value in being able to pick the brains of those people.
I know that MOFAS is making a difference because everywhere I go, I see evidence of that. I went to the Chanhassen Dinner Theater, and a waitress asked me about MOFAS. And she had been a foster mother who had received training through MOFAS. And she said without that training, she would never have been able to deal with her child the way she did. She was so thankful about MOFAS. And I see it with professionals, with trainings that they receive through MOFAS.
And it's important to get these messages out there to other providers too, to provide a very clear message about alcohol and pregnancy, because there's a lot of people that, even though they've gone through a lot of education, have not necessarily specifically heard information about alcohol and pregnancy. And many women of my age were not given these messages when we were pregnant. So I've certainly heard lots of women who are the grandmas-to-be confused about information that their daughters are telling them. So even because someone's a healthcare professional doesn't mean that they necessarily have the correct information about alcohol and pregnancy, and I just think it's important to get that message out there.
Many areas, I believe, that MOFAS is making a difference. I think for families particularly, before MOFAS there was not a place where they could get help. So now there's a virtual family center, there's the trainings for parents, there's camps for the families. So families really have a place to go, a home. and we hear that all the time. The policy work, the day on the Hill. Before there was not a voice. Parents now have a voice that they can go to the Capitol and bring that face to the legislature. And that was never there before. The Diagnostic Consortium, where now families throughout the state, there are different places where diagnostic can happen. And when I first got involved in this, I thought that diagnostics was a key, because if we cannot identify the population, if we don't have a face, we're not going to make changes in the state of Minnesota.
We're seeing parents talk about how they don't feel alone anymore. They don't feel so isolated. Families with a child with an FASD go through cycles of grief and cycles of isolation and shame. One of the things that's so hard about fetal alcohol is the invisibility of it. Even in relationship to other mental disabilities, it's more invisible than many of those. There's just not a lot of children with the look. And so we find parents describing shame a lot of times in their blogs, in their messages, and on chats. But as they become more transparent with each other, what they're figuring out is they all feel that way, and that these behaviors that they're struggling with, they're all using different interventions, different strategies, but they're really tough behaviors to handle, and they show up as bad parenting in the community. So when they get together on the VFC, they figure out that they are not judged. They're not looked at as these dysfunctional parents who are raising, deviant children. They're actually, we're patting each other on the back a lot of times as moms and as dads, and saying, I never even thought to try that with my child. Thank you for telling me that. I'm going to work on that too.
I think for volunteering and for donating, I think it's a very similar message. And what I would tell someone, there's no doubt that that I can tell my friends and family and people that I meet that, when they're considering donating or volunteering, just give a phone call. I know that their phone call is going to be returned. I know that their information that they're seeking is going to be provided, and provided in a way that's engaging and honoring their passion. And so it's very easy to tell people, just give them a call, because I know that that there's going to be a wonderful and embracing response.